Hi, everyone. It's me, Fran Drescher, the founder and visionary of the Cancer Schmancer movement. And we are bringing you a new series during these pandemic times called Corona Care for You. I'll be interviewing all our medical advisory board doctors to give us tips for how we can help our families stay well and beat this thing and not feel helpless and hopeless. So I'm very proud to introduce one of our favorite doctors, Dr. Uma of Uplifting Health and Wellness. Hi, Dr. Uma, how are you?
I'm wonderful, and thank you so much for having me here, and I feel very, very blessed to be able to share some information with all of you.
Now, as we know, if you're a member of Cancer Schmancer, Dr. Uma is a Harvard medical doctor that switched to becoming a cannabis expert and a leader in the field, making it user-friendly, bringing the knowledge and information to the everyday person to not be afraid of it, but to embrace it and understand its importance in our daily life. So, Dr. Uma, along those lines, do you have any tips or advice for us during this pandemic on how cannabis can be a support to our systems?
Absolutely. It's interesting because when people understand that there's a system that we've shared with all of our listeners in the past, is that we have an endocannabinoid system, and we understand that cannabis works with this. And it is actually, in one word, about homeostasis, bringing people balance. And I call it being at ease. And cannabis is a valid option that's out there. It's been well studied. And in many states, it's also a legal option, making it available. What we've learned is that right now in Massachusetts, with this whole pandemic, there's been some restrictions that have been placed. Patients cannot access it unless you have a medical card. So adult use patients that were using it as the word recreational, which I don't like to use, but adult use, are now not able to get it, which means that alcohol is readily available, which is considered essential. Pharmacies are open, drugstores are open, and which makes me a little bit concerned that are we going to be using more drugs, more over-the-counter meds, more alcohol, more nicotine, kind of all goes hand in hand. And
is Massachusetts the first state to impose this increased prohibition on the cannabis?
Well, the governor has made it that adult use is stopped. It has been stopped mainly because his thoughts are in Massachusetts. There's no really other nearby states with adult use, so it would cause more people to come into the state, and we don't want people coming in, and again, having minimization of social distancing. And hi, beautiful. And one of the things that's very important is that we want to make sure at least the medical patients can have access to it, and that there is supply for it, and there has been an increase in medical patients that are being registered right now.
So, well, that's positive, I guess. I mean, if you want it, you can still get your card to enable you to get medical cannabis. Are you in agreement with this kind of protocol?
I'm a public health person, so when we look at the greater good of what we have to protect, I think there could be other things that could be made, but I understand what the governor is doing as far as right now. If you had a choice and to protect the Massachusetts residents, but I think there can be made provisions that at least Massachusetts residents can get access to it, and other states have done that. I know California has kept it open for their residents as well.
Mm-hmm. I guess we have a lot of nearby states that also have legal marijuana, both adult use, as you describe it, as well as medicinal. So maybe the fear of encroaching outside citizens coming in is not as big a threat. Now, I think that there's been a lot of talk about the mental strain that this pandemic is putting on people, not only because they have financial concerns, they have a lot of fears about their health and the health of their loved ones. There's also a level of depression that we're seeing amongst people that are forced to stay home, shut that may not have access to communications such as this and are alone, maybe don't have pets and things like that. And I've always thought that, you know, cannabis with the THC, which helps work on the mind, the brain, might be a positive thing during this time. So would that be a reasonable reason to be able to get the prescription if you're feeling blue?
Absolutely. So this is where choices are, you know, safe alternatives. And in the Ayurvedic medicine, they describe cannabis as a plant that is a sacred plant, and that there was a guardian angel, and it helped with fear and anxiety. And
could you just tell us what Ayurvedic medicine is for those out there listening that don't know?
Well, I like to take the word apart. Ayurveda. Ayu means life and Veda means knowledge. So Ayurvedic knowledge has been around for years, and we've learned about it. You know, now we call it science and proving the research, but they knew about so many different types of herbs that have been out there and the practices. And my grandmother, you know, that would look at you and knew what was going on with you. She was not a person that had any type of a formal education. She didn't even read and write, but they learned about so many different herbs, and it was passed on knowledge, and they knew how to protect people. And when you look at all the rituals that we did years ago, you know, you didn't bring your shoes into the home. You took your clothes off. You know, you wore your slippers outside. You didn't wear those slippers in your home. You know, there's all of these hand washing things that you always did before you ate. We ate with our hands. You washed your face. There was this different rituals that people did. And so when we look at Ayurvedic medicine and how cannabis was actually brought into this country and to Europe, because William O'Shaughnessy first learned about Ayurvedic medicine, and how back then he learned about cholera and tetanus and how they used it for all of these different ailments, including mental health. And cannabis was used in this country, and it was prescribed for alcoholism, insanity, opioid addiction. And these were the indications that cannabis was prescribed for and used. And so right now, I feel that if people could still understand that you do have an option, and if they can acquire it and know that it is produced clean and safe, these are very valid things that they can use. It can be used for anxiety. It can be used for pain. It can be used for sleep. And it can also help people to just relax. You know, and you do want to forget a little bit as well.
Can I ask you a question? Because obviously we know with this coronavirus that it's a virus that likes to be in the respiratory system and replicate itself there. It particularly likes to go into the lungs. So is there a delivery system for the cannabis that, given the current circumstances, you would recommend versus inhalation? Or do you find that inhalation is a non-issue even with coronavirus?
You know, it's very interesting you bring that up, because cannabis was used as a bronchodilator in this country. We used it for asthma. We used it for tuberculosis in India. And hemp was actually made into a broth, and they used it for as a treatment. So this is where I would love to see, where I've been telling my patients, get a peak flow meter, okay? And
what's that?
A peak flow meter is used, it's a small device people can even use. Have you ever seen those things that they use that you blow a ball and the ball goes up?
Yes, to take a lung breathing test?
Exactly, but they're little small things that can be available that people can purchase. They're available at the, if they've been asthmatic, they usually have it, but anybody that's got a lung disease, but you can get a peak flow meter. And if they have any concerns, I've been telling them, use it, blow, record your numbers, use your cannabis, inhalation, use it again and see what your numbers are before and after use. And this is where cannabis has been known as a bronchodilator. It's a vasodilator and also brings down inflammation. So this is where if the product is clean, if we know for sure that people can adapt to it, and I tell people inhalation is very short acting. It's quick onset. So if people want to try it, it's not a bad thing. But again, you got to remember the pros and the cons. Some people can get very anxious with it. So this is where it's the treatment for anxiety, but it can also cause anxiety. So we make sure people are well hydrated. Make sure you got food on board. And I tell people, write things down, because this is a very much an individual perspective and how it makes you feel. And
now, when you say have food on board, does the food serve as a means of modulating the feeling that you get from using the marijuana, the cannabis?
Because it can cause your blood sugar to decrease. People get a little hypoglycemic. And if somebody's not eating, they know how to get when you're anxious or when your blood sugar is low. So that feeling can set in, and that can be very alarming to somebody that doesn't know how they feel. So these are where making sure, and I tell people, hydrate with a little bit of lemon, lime, people have mint, cucumbers, whatever you like, and even use that as a delivery system for you to be able to microdose even. People are using their water. If they don't want to inhale it, they can microdose with tinctures.
To buy that, you have to buy that in that delivery system, right?
There's tinctures that are out there that are available because they don't have the THC in it. There's many over-the-counter stores, even nutrition supplements are available as CBD tinctures. But the ones that patients are getting through dispensaries usually have a 1-to-1 ratio, or they might have different varying ratios. My rule is start out low or very low and slowly titrate up a little bit at a time, and make sure you have the food on board as well.
Now, I'm interested, you had mentioned that years ago they used to make a cannabis broth, and I find that very interesting. I've never heard that before, and I'm just wondering, is that something you can make at home?
Absolutely. So, there's two aspects of this. There's the actual bud that you can get from the cannabis bud, and I have patients maybe take even a chamomile tea bag, a little piece of bud, 3 cups of water, and just sip on that. You can make that as a broth, like you say, and sip on it as a tea. People also take hemp. You can get hemp hearts and make that as a porridge. People can eat that as well. And, it's an easy way to incorporate these things because they're natural anti-inflammatories. Go
ahead.
Small amounts that they can incorporate into their food and diet.
Now, the hemp hearts, because you had once told me, to just eat them, those are hemp seeds, right?
It's the same thing. So they call it hemp hearts. It's from the seed, and 3 tablespoons of hemp hearts, 10 grams of protein, about 180 calories. And what's beautiful about it is some people are not eating meat and they're not eating fish. So this is a perfect omega-3, omega-6 ratio, but we want people to eat a well-balanced meal.
Right. Oh, that's wonderful. Okay, good. They're tasty. I bought a bag of organic, of course. And, it's got like a nutty flavor to it, and it's really lovely, and I appreciate you recommending it. One of our members wrote in a question that I thought we could share with you if you're open to it. This is from Selena Cortez, and she asks if there's any changes in diet or activity that me and my family should do now that now that we're confined to our home.
I love that question. I've always encouraged, I call it the 7-minute date night. Take your pet out for a walk, take your significant other, take your child out, alternate, who you would like to go out for these 7-minute spurts. It doesn't have to be long, and you could do them with different people throughout the day. Even stretching, Sivaji is so into personal training, and he'll say, breathing, get together with everybody and breathe together, getting a small ball, even activity that you can do together, as far as getting the family involved in that this is important. And reading together, reading stories together, I think is a great idea. I love singing. I love to sing a song together. If they like to play music, try to, even if it doesn't have to be great. It's just about getting everybody together. And I think turning off their phones, turning off the TVs, and having some time that you bring together is very important.
That is amazing advice. And dancing is fun too. It's an exercise. You put on the music, the whole family just starts dancing together. So I think that it's a new normal, and everything that you're saying is really invaluable information, very, very useful and helpful. And we appreciate everything that you do on behalf of the greater good. I encourage everybody to go to upliftinghealthandwellness.com and learn more about what Dr. Uma is doing and how you can incorporate her wisdom into your life. I thank you all. My prayers are for you. We at Cancer Schmancer are constantly putting up wonderful viewer-friendly information and videos on our website, cancerschmancer.org, and we urge you to go there as well. This is a time when we're distant but must stay together in this and learn as much as we can and remain empowered and calm and in gratitude. So thank you again, Dr. Uma. You're absolutely incredible, and I just adore you. And thank you for being such a maverick in the cannabis space. You're exactly what everyone needs to represent this, because you're so intelligent and so well studied, and such a well-trained medical doctor that you validate everything that we should be learning and discount all the things that are just basically lies and propaganda. So thank you again, and I wish you and your family well. And
keep doing what we're doing. We say 3 words: educate, embrace, and empower. Reach 1, teach 10, teach 1, reach 10. Keep spreading the word and understanding that we're going to get through this, and there are going to be other pandemics that will come, but we'll be ready.
Exactly, because at the end of the day, we have to start embracing a lifestyle that complements our body system, our immune system, not tries to deny it or defy it, because then it won't be there for you when you need it. We have to stay very connected to our bodies and honor it and understand what around us may be compromising that, because how you live equals how you feel. And that's the Cancer Schmancer way. So God bless you all, and thank you for tuning in to Corona Care for You, hosted by me and Cancer Schmancer. Hi everyone, it's me, Fran Drescher. Well, I hope you enjoyed Corona Care for You, and if you did, please think about making a donation to us at cancerschmancer.org/donate. Like so many nonprofits, we've had to cancel all of our fundraising events. So it's really up to you to help keep us going. We depend on your donations, your support, and your love. There is no donation that's too small, and we are grateful to anything that you feel comfortable giving. And continue to come in to the Cancer Schmancer Corona Care for You series, because we are constantly posting new content, and we hope that it's helpful to you and your family. Don't forget to donate. We really appreciate your support. Thank you.